Hi, I'm Dr. Alexander Nedopil, an orthopedic surgeon at Adventist Health Loader Memorial, and we are here today to discuss what you need to consider when thinking about a total knee replacement. Most patients who undergo total knee replacements are between 50 and 80 years old, but orthopedic surgeons evaluate each patient individually. The most common reason for undergoing a total knee replacement is knee pain that is limiting your activity of daily living. Long-lasting pain that does not improve with conservative measures like adjusting your daily activities or taking anti-inflammatory medication. Also, if you feel that your daily activities are significantly inhibited or you have night pain, then you might be a good candidate for a total knee replacement. Undergoing surgery is not something to take lightly. The patient has the right to choose the physician that he's comfortable with, and I think that is very important. The patient should also know which method the physician is applying to replace the knee. My personal approach to total knee replacement is kinematic alignment. That co-aligns the joint line of the replaced knee with the joint lines of your knee, how it was before you had osteoarthritis. That helps you with a faster recovery and gives you more mobility after your surgery.